Dear doctors and friends, and my patients and colleagues, I welcome you all to this CME, which is Continuous Medical Education, on how to beat the impending third wave of COVID in India. For those of you who do not know me, I am Dr. Shrikant Ken, consultant knee and hip surgeon, and these are my qualifications. Particularly proud to have worked at Wrightington Hospital, birthplace of joint replacement surgery in the world. And I was formerly a consultant in joint replacement surgery and trauma in the UK. At present, I am proprietor and MD of Sarthi Superspecialty Knee and Hip Center, and also the upcoming IOC in South Bangalore. We are coming up with probably another 2 to 3 new units for COVID patients. They are right now under construction. And for those who want more details about me, this is my website, shrikantken.com. You can go there and you can get pictures of the upcoming projects as well. For those who do not know me and joining me for the first time, I trained in United Kingdom in all aspects of orthopedics and trauma. I have specialist interest in computer-assisted robotic knee and hip surgery, patient-specific implants, for which I did a General Medical Council recognized fellowship at Plymouth Teaching Hospitals. This is a presentation of fellowship by Dr. Jonathan Keenan, the Director of Orthoplasty at Plymouth Teaching Hospitals. And in recognition of excellence in knee replacement surgery, I was nicknamed Shri the Knee. And you can see a picture of me with a bat on one hand and a revision knee implant on the left hand at beautiful Plymouth Harbor on the background. And my second fellowship was a revision knee and hip fellowship at Avon Orthopaedics Center in Bristol, UK, one of the 5 specialist orthopedic hospitals in the UK. I worked with Dr. Everett Smith, the UK head of European Hip Society. He's an amazing teacher and a mentor in hip surgery. And Everett is not new to India, as he visited Bangalore and Delhi a couple of years ago, and we did amazing surgeries together. And also worked with Mr. Anthony Ward, the director of pelvic acetabular surgery for southwest of UK. This is my third fellowship at Endoclinic Germany, which is a mecca of infected revision, with Prof. Gurkha. Prof. Gurkha doesn't need any introduction in the orthopedic world. He's one of the person who does septic revision for almost all the implants in the world, and they're also doing a single stage revision for the disc replacement surgery. It's unbelievable. And so he's one of the few single stage septic revision surgeons for the world. And why this fellowship becomes very important at present, during the COVID pandemic, is because we have noticed in the last 2 months that there is an increased incidence of gram-negative infection in the humans, and particularly in the joints. And sepsis of the joints with gram-negative will be on the rise. And having treated them, I can bet you it's an incredibly challenging thing to manage. And there's an increased incidence of avascular necrosis of the bone, particularly of the femoral head, leading to necrosis. Means in Kannada we call it koliodu. So the hips are dying, particularly in the young people, because of steroid abuse, and more of these young people will end up with a hip replacement surgery in the near future. And because of immunodeficiency caused by COVID and all the use of steroids and immunosuppressants, there is increased fungal infection, and we will find that more and more fungal infections will be found in the joints as well, and in the orthopedic, bones as well. This is another person whom I can't forget. The immediate past president of British Knee Society, Dr. Richard Parkinson. He's my mentor, and he's a person who enthused me into knee surgery right way back in 1999, 2000. If I go back at that time in Bangalore, I don't think many top surgeons at present of Karnataka had even started doing knee replacement surgery, but I was already doing in 2000 knee revision work with Dr. Richard Parkinson. So it's absolutely amazing how the journey has been. So he was the president of British Knee Society from 2014 to 2016, and he was voted the top 10 best knee replacement surgeons and trainers in the UK. And, I was in a meeting a couple of days ago with the Indian Orthopaedic Society, now called the British Indian Orthopaedic Society, BAOS of the UK, and going through a lot of their presentations. And, I just looked at myself, how I moved on. And, as a consultant doing trauma and some joint replacement surgery. I moved on to doing computer-assisted surgery, then the patient-specific implants, and now I'm using robots. And many of my consultant colleagues in the UK who are working in the district general hospitals in peripheries are not even doing what I am doing right now in Bangalore, because of the resource constraints, and the DGH, you can only do so much, and you need to be in big cities like London, Bristol, or Oxford to do these amazing surgeries that I'm able to do in Bangalore. This incredible insight I got just a couple of days ago. Coming to where we are, I always pride our center associate to bring experience of Europe in India or Bangalore. And there's a lot of international collaboration which occurs between my center and the overseas teachers. And this is the first spare approach to hip in India. This is a minimally invasive approach, first time being performed in India at All India Institute of Medical Science by Dr. Everett Smith and myself. This was the inaugural Meet the Masters course. In Bangalore on the right-hand side, where Dr. Everett Smith is being felicitated by my teachers, Dr. J.K. Reddy and Professor Purushottam, and my good friend Dr. Amarnath. So it was unbelievable to have these great, friends and teachers and mentors with me at that time. This is the last Meet the Masters program we conducted, in 2020, and this is, Professor Alistair Hart. He doesn't need any introduction. His achievements are incredible, and he's somebody who's he's a principal investigator in 26 grant awards since 2006, with a total funding of £7 million. It's an incredible thing. The BBC has nicknamed him as a hospital hip detective, and he has, he's published all over, including New York Times, the Times, the Telegraph, and it was incredible to meet him in London in 2019. And because of association with such great professors of orthopedic surgery, the best advice for me is always at my fingertips. So I was recently in a meeting with a vendor in Germany who was trying to send me some 3D osteotomy guides. And, he just showed me 2 days ago that Dr. Srikanth, I purchased this book, The Hospital Hip Detective, from Professor Alistair Hart. So it's such a small world. So it was really pleasure meeting him at London Implantatorial Center. And he's on my right-hand side. And on my left-hand side is Professor John Skinner. He's the president of British Orthopaedic Association. And Professor Hart gave an amazing talk about future of orthopedic surgery, particularly using 3D printed implants and how they could be the future of orthopedic surgery. Coming back to the subject matter, India was shut a couple of months ago for repairs, and this talk is all about how to dodge the impending third wave. Coming to COVID-19 pandemic, I think the accurate term now needs to be called as a CCP virus. It's a Communist Party of China, or a Chinese Communist Party virus. I will come to know why there is a right term for this, because it's wrong to call it as a Chinese virus or an Indian virus or a British virus or a Peru virus, etc. Because it's not after a country, but it's after who really were brains behind this whole concept. The world and India went through an unprecedented times, devastating times as far as India is concerned, with around 4,000 to 6,000 lives lost per day for several weeks, and we now have around 4 lakh Indians who lost their life since the first wave, and we have 40 lakh people in the world dead because of this virus. Somebody asked me, just recently, doctor, is this really true or just media hype? I told them, no, definitely the 40 lakh people are dead in the world. It's just not media creating the, whole thing. There's no conspiracy here, really. We are unlucky to be witnessing and going through this second wave, which is once in a 100-year pandemic after the Spanish flu of 1918. And hopefully, we are getting ready for the third wave. It's a whole, reason why this CME is being done. The Spanish flu, as you know, came in 4 waves. It's lasted for 4 years. And the second wave was the most devastating, killing 40% of the world population at that time. So we need to learn lessons from history, and we should be ready for a few more waves of this COVID-19. And depending on our behavior, the next wave could be worse or better than the previous waves. So a virus need not stop our way of living if we had learned the lessons nature is trying to teach, and lessons from the past, like the Spanish flu, and we need to learn lessons from the past mistakes, what people have done. We saw in first wave, the UK and the US government dismissing it as just a flu and saying economy is more important. How people died on the streets, and the health system was overrun very quickly by this virus. And India luckily went in for lockdown. I'll tell you the reason why. And then, but we didn't learn lessons from their mistakes, and then we repeated it during the second wave, saying that, oh, we conquered this virus and things like that. So we need to learn lessons not only from the past mistakes of ourselves, but also of others, and that's the key thing. So how to be optimistic in a pessimistic world? It's a once in a lifetime event. 50% of the world population was under some form of lockdown, and this might increase or decrease on the stage of the disease. Millions of patients with chronic conditions and serious non-COVID conditions affected due to the second wave. Depression, suicide, and opportunism is on the rise. Not only opportunistic infections, but also human opportunism is on the rise. We still don't know everything about this new CCP virus, particularly COVID 2021. It's probably not the same as a COVID-19. We have now what is called as the Indian strain or the Delta strain. It's mutated to Delta plus. And recently the Lambda strain, it started in Peru, has spread to around 80 countries, supposed to be more virulent and more deadly and more spreading. And, that may be the next wave, which might dominate in India. And we also have the epsilon wave, which is epsilon variant, which is sort of avoiding the vaccines or dodging the present day vaccines. So every day new facets come to light. It is not only a pandemic, but also infodemic, because there's so much information coming about the virus and what's happening, throughout the world. And it's always difficult to process this. And we have concepts like the fecal infection, the route of spread, transmission through feline like cats and tigers, from the dead bodies, from the AC, which is being turned off nowadays in most places. And, the airborne transmission is well established now versus the fine droplet infection. And by talking, if you're talking too much without wearing mask, you can spread. And asymptomatics can spread it before they actually got the disease. And 2 meter was called a social distancing, but it's probably no longer true, because aerosol spread can happen in closed spaces, like a smoke in a cinema theater. And if you're in a 4-hour movie hall, then it can infect all the people within the hall. And 2 meters doesn't really matter. It's a closed spaces with no ventilation. It's more important. And brain neurotropism, virus has affinity towards the brain. You will learn about it. The heart can be affected, and coagulase. COVID-associated coagulopathy, very, very dreaded complication, which can lead to a lot of problems. And we can have multi-organ syndrome, leading to death. And happy hypoxia, very typical of this virus, not seen in the previous diseases in the world, where the person is talking, walking, but he has got a hypoxia and suddenly he drops down dead. And the long COVID, there is an effect of COVID after 4-6 weeks after recovery. We'll discuss that in detail, what is happening, including the cytomegalovirus infection causing bloody diarrhea, and the pneumocystis carinii infection, which is affecting the lungs, all because of immunocompromised condition. And the avian, which I described about the hip, avascular necrosis, and the gallbladder disease like cholecystitis being caused by the virus. So what's the difference between 2021 and 2019? I think the COVID-19, the Wuhan CCP virus, was a milder virus affecting elderly, and it's less speed of transmission. The young handled the virus very well, and the mortality is quite less than 1%. But a COVID 2021, the Delta variant, which is called B1.617.2, or the Delta plus, it spreads 70% faster and affects all age groups from newborn to 90 plus. It has got a shorter incubating period between 3 to 5 days, and its rapidity of spread is what causes more infections and more numbers. And when the numbers rises, the fatality also rises from 1% to 1.5 to 5% with this. And the young are unable to handle the cytokine storm in this particular wave. And we got the Lambda, the Peru variant, and apologies. We got Lambda or the Peru variant. Yes, as I was mentioning, the Lambda or the Peru variant has already spread in around 80 countries, particularly in the Latin America. And it's supposed to have faster spread, and it's supposed to be more lethal. And it can also have a vaccine escape. Also the epsilon variant also shown to have a more vaccine escape of available vaccines presently used in the world. Did we miss a trick? Did we miss a trick? Yes, probably yes. Because the story of Spanish flu is almost kindergarten stuff, and everybody knows about this. And despite knowing that it came in 4 waves and second wave was lethal, we probably took our eyes off the target. And I think there was poor leadership both at the state and the central level, and particularly from COVID task force, which was probably a little bit sleepy. And we had our health minister who celebrated the end game of COVID. And, in fact, he made statement in March 2021, how India has tamed the beast. And Netas were celebrating this even in international meet when already the second wave was beginning. And, quite rightly, I think he's been sacked and replaced by another minister right now. And hopefully, he can be a bit more proactive, than sort of sleeping on the wheel. And, the warning from the experts were ignored. I still remember in November, December 2019, I was one of the first persons to warn PMO for the lockdown, as they frankly didn't know what to do. And all these, the top guys who are part of the COVID task force now are all busy minting money in their corporate chains, and they never realize the seriousness of the situation. And in fact, the research coming from the West was very clear even in December 2020, 2019. And then frequent sort of messages to both the PM and the PMO really made them take steps. And I think if you realize India was one of the first countries to block all the flights from Wuhan and China as such, while the Europe and UK and Italy particularly and America allowed these flights to come and bring virus in droves, causing a complete pandemonium both in US and Europe. So I think in the second wave, what happened was the first wave they listened to scientific experts, but in the second wave they knew everything, and they had great experts, basically yes men who are part of the COVID task force guiding them, and always politicians never listen to scientists. That's the problem. They always want to change the narrative and then use it in a different fashion, but scientists tell what is the truth. So medical leadership is all about telling authorities what is the truth, and if they are wrong, you need to have the courage to say you are wrong, and not thinking about the effect of it on their chain of hospitals in India. That is not medical leadership. And I think, that sort of, that 3 lakh deaths which has happened, perhaps were avoidable deaths, if you had really shown good leadership, both at political level and at the medical level as well, And if you ask, Chalta hai, what is there, how does it affect me? This is how it's always India's run like that. Poor leadership can cost you your life, and nothing can be greater for you than your life. And if you're dead, all your money, whatever bank balance, the Swiss account, everything is wasted. So, it's something you really need to sit up and take notice and make sure that the poor leaders are, sort of phased out, so that India can get good leadership, which can really save our lives. So again, how to be optimistic in a pessimistic world? It's a new virus in a non-immune world. The R0 of the virus was supposed to be 1 to 3 initially. I think this gradually crept up. For the Delta strain, it's around 5. And for the future strains like measles, it can go up to 15, I think. Virus is at present 10 times worse than the H1N1 or the bird flu. And mortality, as we discussed, is between 1 to 5%. We need around 80 to 90% either infection or vaccination to get the herd immunity. And vaccine is the only way out of this pandemic. And, poor planning had led to vaccine shortage, but I understand that it's improved, although we are just hitting around 28 lakh per day due to all the restrictions, which again political and not scientific, which is again very sad because politics should not kill lives, it should save lives. And we know that more than 80, there is increased mortality. And I always believed in the contrary, that anyone can die if exposed to sufficient viral load. And ICMR in its own publication, in the first wave itself said that 83% Indians who were infected were less than 60. I saw several big COVID-19 experts coming on TV and papers saying that, oh, we are above 60, we should not be working. It's the young doctors who have to work, but on the contrary, it was the young people who are dying. So it was very strange, how they kept on coming on first wave, second wave, saying that above 60 should be at home while the young people should die. It was incredible leadership, really. So now coming to, this virus can also affect the newborn with query placental transmission, toxic shock syndrome, and, the multi-systemic inflammatory disorder of the children, which is a very well-known established entity now, and COVID toes, which are inflammation of the toes. And there were some questions regarding blood transfusion was safe. Probably looks like that. And the healthcare workers are exposed to danger like this never before. 15 to 20% infection among them compared to 3% for others. And healthcare workers 33 times more at increased risk of getting the disease compared to a normal Aam Aadmi. And it's very shameful that such a healthcare worker like an ASHA worker, he's paid 2,000 rupees per month. It can't be more worse than that, kind of a travesty of justice, really. So coming to COVID-19 and what we know in July 2021, it's a new CCP virus reported in Wuhan, a milder form version to begin with. And it was very aggressively stamped down, and clamped down by China. I think hats off to them. I think they didn't allow it to spread in Beijing and Shanghai, which are neighboring states to Wuhan, but they allowed it to spread into Italy and US by not blocking the flights. Thanks to our guidance to Narendra Modi and to the PMO in December 2019, that we blocked all the Chinese flights from coming from Wuhan and other parts of China to India, which was the biggest step, which really saved Indian lives, and why first wave, Modi was a success. And so there's a lot of questions being raised. Is it a biological agent? And a lot of evidence is coming out in this regard. The work on gain of function of this virus, where this SARS virus was being combined with the HIV virus to make it more infective. It's going on for decades. And I think US, Canada, UK, China, and India have been at the forefront of this research. And the Indian hospital data was hacked in February, March 2020. And several hospitals, corporate sector hospitals in India, actually have got ownership in Singapore. And it's always believed that a Chinese underworld agency called Spider have been the real funders for these institutions. And it's very, very easy for them to get data. And you can just see in the last 6 months, so much of hack has happened. Air India has been hacked, and all our details have been given to the dark net. Also, the school data, Domino's, many pizza data with all the credit card numbers have been hacked, because our cybersecurity is very poor. Our cyber laws are very poor, and they don't have the teeth. Because the judiciary is not very, very effective in the country. So these are all the issues that one is facing. And, so they had the data of different people, particularly Indians, and they know what the diseases the Indians suffer from. So it's easy to target and, machine things to that effect. So the mutations more virulent have affected the US, enemy of China, Europe, India, and Japan. You can see the Olympics, emergency being declared now during the Olympic Games. Is just incredible. How these anti-China countries are more susceptible than China itself. So the overall effect has been that the world has just become a sicker place. You'll just see why I'm telling this. If you just look at what this virus is doing, in July 2021, let's start from head to toe. What are the effects of this virus? Let's look at the CNS, or the central nervous system of brain. We know that this causes around 10% stroke, and people having stroke, they lose power to the limb, and it's a very long-term disability kind of condition. We know that the virus has got the brain neurotropism, so there's no smell and no taste for people who get the virus, and the inflammation of the brain called encephalitis and meningitis can occur. An abscess can occur. Mucormycosis can form a mass space-occupying lesion in the brain and can cause fits. And we can also get depression and psychosis because of the virus. Now, coming to the eye, that's one of the routes of entry of the virus. It can cause conjunctivitis or the red eye or madras eye, as you can say. And we know about the mucor, which is a fungal infection which goes behind the eyeball, eats up the eyeball, causing permanent blindness. Nose, one of the portals of entry of the virus. We know anosmia, which is loss of smell and loss of taste, and mucor affecting the paranasal sinuses, just destroying the face completely. Heart, we know it can cause myocarditis and pericarditis, and that can cause conduction blocks, and heart can stop in systole or diastole if there's a block. And the clotting in the vessels of the heart can cause myocardial infarction, leading to death. And all COVID patients should be very careful 6 months following infection, and take extreme care and make sure that you are on good anticoagulants. Lungs, it's another direct organ being affected by the virus because it comes through the nose into the throat and enters the lung. COVID lung is a well-described phenomenon now. We got fibrosis, the lungs sort of shrinking because of extra fibers formation. And it can form bullae, which is, gas-filled balloons within the lung, and that can rupture, causing what's called as a pneumothorax. A sudden gush of air outside the lung, it's called a tension pneumothorax, which can kill the person. Has to be treated immediately as an emergency within few minutes to seconds, and then can cause other infections as well. So particularly opportunistic infections like pneumocystis or pneumonia, mucormycosis, fungal balls of different colored fungi like Candida, Aspergillus. These are all opportunistic infections of the lungs, which is happening now. Coming to gastrointestinal tract, we know that the COVID is causing direct pancreatitis, and that can cause diabetes mellitus even in normal individuals, and the immunodeficiency thereof can lead to a number of other diseases. The increased clotting can lead to mesenteric embolism, and that can leads to gangrene and of large stretches of small and large intestine. We talked about the gallbladder inflammation like cholestasis, non-calculus, that is without gallstones. And I talked about the cytomegalovirus virus infection causing bloody diarrhea. There was a severe outbreak in Delhi. And basically, it's like, it used to happen in the AIDS and transplant patient, but it's happening in all normal patients. So it can cause mucormycosis of the gastrointestinal tract. Is a very common site. We'll discuss that a bit later. And liver damage can be done not only by the virus, but also by several drugs being taken to that to help cure the virus. And coming to the kidneys, it can cause acute renal failure and multi-organ failure, where the kidneys are always involved as part of the multiple organ which shuts down. Orthopedic wise, as I mentioned, it can cause avascular necrosis of the femoral head. So that is basically the head of the femur in the hip joint undergoes necrosis, means koltovate in our local language. And it means younger people will need a hip replacement in future. And it can also cause inflammatory arthropathy like dengue, and more patients will come with the pain in the knees and hips and smaller joints. So just like dengue or chikungunya arthritis. We got COVID toes, which are inflammatory toes in the kids. I mentioned about the gram-negative infection, which is on the rise in orthopedics, and fungal infection probably should be on the rise, and increased post-operative infections and complications. And probably the mortality might also sort of increase because of these infections, because joint infections are a killer. And fatigue, myalgia, are very important. Also, orchitis causing impotence. Particularly, just 2 days ago, I was attending one of the young doctors forum, where enthusiastic young doctor has done a bilateral knee replacement. One was a varus knee, as we call, very simple to do, but the valgus knee is a completely different and difficult knee to perform even for the experience. But these youngsters nowadays are under so much pressure. He has gone ahead and done the other knee also. quite well, according to himself, but he sort of neglected that the patient had spinal problems, and I had not investigated further. And patient did well for 2 weeks, and then it came back not able to straight leg rise, that is, lift the leg straight. And then a week later, the patient came with a frank dislocation of the right knee, which is the valgus knee, and subluxation of the left knee. He didn't know what was happening, what was hit, and later realized that the COVID can also cause neuropathy, and the patient had a bout of COVID, which led to femoral neuropathy. And because you're always rushing when you're doing bilateral knee replacement, the balancing can't be perfect, and the right knee dislocated, but the left knee didn't dislocate. So this is a lesson for the young, to be extremely careful. It's not just a question of when to do surgery. Experience will teach you when not to do surgery, and what are the investigation you need to do. There's no point doing knee replacement then start investigating the back. Always look at, if the back patient has back problem, look at the back, investigate it thoroughly, make sure everything is okay, and get it right first time, so that you don't have to go back again and again, keep repeated surgeries, which our patients can't afford also in India. And general problems that it is causing is VTE, there's venous thromboembolism and vasculitis leading to peripheral vascular disease, and probably gangrene of the legs, and other kinds of infection which is happening in the lower limbs as well. Now, coming to what's worked so far in the world, evidence-based medicine. The filtering truth from the noise. This is the best way to filter truth from the noise. We know that lockdown has worked. We realized what happened in the first and second wave. Both times when India did a proper lockdown, the numbers decreased. Otherwise, this is going to just kill us. Social distancing, yes, works. It used to be 2 gaj ka duri, 2 meters. But now we know that airborne transmission can spread within a room, so ventilation is more important, and less than 2 meters is no longer important. And it was said that 15 minutes exposure was needed for virus to spread, but it could be less. So hand hygiene is very important, and also toilet hygiene, because the fecal-oral spread of the disease, surface transmission is found to be less important now. Very, very important. The N95 and a 99 mask, for all. It's the most important thing. It's called social vaccination. There's the one thing which is 100% effective. It is cheap. It can be used in all age group. And you need to do a real important thing is you need to do fit test. It's not just wearing mask improperly. And just remind me at the end, I will give a practical demonstration of how a fit test is done with a real mask, and then how it is used, because most people are using on the streets in the wrong way, and that can in fact increase infection. So, and there's no concept of home quarantine. I think we have to learn from Chinese. The Chinese, when the infection hit them, they scan everyone's temperature. If positive, they didn't send them to GP clinic or hospitals, but they send them to fever clinics in car parks with full PPE, and did blood test, mobile HRCT, got the CT number, and if the RT-PCR came back in 6 hours, the patient waited there. If it's positive, admitted in the hospital, otherwise send him isolation in a hotel. So the 80% spread of the virus happened in Wuhan during home quarantine. So they essentially avoided home quarantine, but the rest of the world have not learned this lesson, from the enemy. It's just very slackness in the approach, really. So, and homoid masks are useful, particularly if you double mask for the new variant with a surgical mask first, or a normal mask first, and on top of that a surgical mask. Respirators like N95, 99, or FFP3, FFP2 are useful. PARP, 3M respirators with filters are extremely useful. Medicines which were, there's a question mark in HCQS and ivermectin. Doxycycline has been used. The antivirals, remdesivir, there's a huge hue and cry, but sort of equivocal results with this. Virafin has shown some promise. Monoclonals are the new toys of interest, and they're really making a change. And interleukin-6 blockers, discredited, but again, I think the publication last week shows that they are quite useful in handling cytokine storm. And high flow nasal oxygen versus non-invasive ventilation, very, very important. And 2DG showing a lot of promise. Prone positioning treatment, very, very important. And steroids usage at the right time. Not, I saw some political parties giving steroids to all the patients, and their constituents and voters, and that is wrong. It has to be on prescription by a qualified MBBS doctor, not any other person. So, so there's several scams for there, like flypyramid, the avian flu virus, that's been used, not very effective. Tamiflu, H1N1 drug, not useful in COVID-19, and plasma has been discredited now. So how to protect our patients and their family from the potential third wave, which is the subject matter of today's discussion. We need to use a fit tested FFP2 or 3 or N95, N99 mask. It is the most important because it gives 100% protection. Hand hygiene, hazmat suits if handling COVID patients. Just remind me about the demo. I'll give it in the end. Attention to careful donning on and donning off of the suits, the hazmat suits, mask, and shoes. It should be protocol driven, particularly with body watching in a hospital. Not applicable to general public, but early signs of infection, you need to quarantine in a hotel. Treat with good air, food, special hospitals, best ventilator support, and competent anesthetists, access to all drugs and oxygen and molotov. So this is exactly what was lacking during the second wave. Hopefully, we don't repeat. We learned lessons from this, and we don't repeat it, again in the third wave. So, how about primordial prevention? This is, never expose a human to virus in the first place. It always works. It can be done by proper masking, social distancing, and a lockdown. So, and hence this virus is also called a socioeconomic virus because it not only hits the health, but also hits the economy of a country. So we discussed about all the long COVID complications. On the right-hand side, you can see all the different diseases from head to toe which can be caused. But I'll touch a little bit about the fungi, particularly the black fungus, mucormycosis. Before going to opportunistic infection, corona is a multi-system disorder. It hits the pancreas, and steroid taken during the second week of infection increases the blood sugar levels. Remdesivir taken during the first week hits the pancreas. So potentially, COVID is a very diabetogenic condition. And the long COVID, there's a global health is destroyed, and the doctor becomes your best friend. I think it's very important for not only Indians but world over for people to treat doctors and healthcare workers with respect, because they are your best, bet against the virus. They are the ones who are going to save your life, not your netas, babus, judges, film and sports stars. So let us look at this mucormycosis. It's not a true black fungus. It's just, it doesn't produce melanin. So it's just a fungus which causes necrosis. Necrosis looks black, and hence media has called it as a black fungus. It's called COVID-associated mucormycosis, CAM. It's a medical emergency. COVID is not a medical emergency because 85% of patients have a mild infection, 15% have severe infection, and 1 to 5% succumb to the virus. But mucor has got 50 to 60% mortality, so it is a medical emergency. These spores of this fungus are inhaled by COVID patients, pre, during, or post-hospitalization. So they are present in the soil, so avoid gardening and construction related activities for a month after or 2 months after the COVID recovery. Last year the presentation was post-discharge, but this time this happened during hospitalization, and Bangalore itself had hundreds of cases of mucormycosis, particularly in my friend's hospital, Trustwell, and also Boring and Lady Curzon Hospital. COVID-associated mucormycosis, common presentation is called ROCM, which is called a rhino orbitocerebral mucormycosis. The rhino means it comes in the nose, and you get a stuffy nose, brown bloody discharge, and the sinus pain, and loosening of the upper jaw, swelling of the cheek, and numbness there. And then it spreads to eye, causing eye pain and double vision, and then it destroys the eye. And then it enters the brain through the eye and cause headache, fits, and fever, and skin necrosis, which leads to blackening, and hence the term black fungus. As I mentioned, spores can also enter lung and cause pulmonary mucormycosis, causing fever, cough, bloodstains, sputum, chest pain, and fluid in the lung space called pleural effusion. And it can affect the gastrointestinal tract, called as mucormycosis of the GIT, and causing bloody diarrhea and vomiting. The investigations are the MRI of the parallel cells in the brain, very, very important. There's a mucor package available now through many of the diagnostics where you save a lot, where They look at the CT and MRI of the regions with also some fungal cultures. CT chest thorax is very important, and the ENT people will aspirate to nasal endoscopy or bronchial lavage and send it to culture for a potassium hydroxide mount and growth. Prevention is a strict diabetic control, use of steroids in selective patients on oxygen, and no self-medication with steroids at home, and no over steam inhalation, which many people are circulating in WhatsApp, and masking, because it can even trap these spores. Apart from it can trap the virus, can definitely block the spores, which are much bigger. Avoid constricted site gardening, and good oral hygiene is very important. And good diabetic and diabetic ketoacidosis management is very important. You need to taper and stop steroids as soon as you can. Taper and stop including 6 inhibitors, which are immunosuppressants. Radical surgical debridement is removed. Sometimes you have to remove the eyeball and remove a lobe of the brain or the lung if it's present there as a localized mass. And medical treatment is expensive, goes on for 6 to 8 months. And basically, you need a long line called a PICC line, and you need to hydrate the patient adequately. And you need to use liposomal amphotericin B, which is a drug of choice. Very expensive. It has to be used for several weeks, and or you can use oral posaconazole for around 6 months. Both are expensive drugs, and we need to ensure that we've got adequate stock for the third wave. The misinformation is that it's not a black fungus because it doesn't produce melanin, and mucar doesn't produce melanin, and there's other fungus like white fungus Canada and green yellow fungus called aspergillus can affect lungs. Mucar is not contagious, doesn't spread from person to person. It's not spread by dirty water, humidifiers. There's no prophylaxis recommended at present for prevention, as the incidence was less than 10%. So, to conclude, I would like to say that SARS-CoV-2 and its mutants are here to stay. Repeated waves are expected. Worst prediction is for the third wave to start in August if we don't adopt COVID-appropriate behavior. But if we adopt, then probably we're looking at November when the third wave should hit. So it's a new flu. We need to learn to live with it. So the e-consultation and e-hospital is here to stay. We need to learn to embrace it. Our mindset has to change as patients, and it's very important because nearly 30 patients a day died in Bangalore alone during the peak COVID because they didn't seek help. And 50% of all deaths in Karnataka occurred in first 72 hours of the admission, which means they all went late to the hospital. We started the e-hospital service, and we knew the difficulty of patients. We charged it very, very normally, 500 rupees per day. For a team of 5 doctors and physiotherapists and dietitian. And this was the lowest compared to all the charitable hospitals, including St. John's. And, I'll tell you how many patients use the service in 2 months, 5. This was absolutely shameful. Although wide advertisement was given to that, people, take all kinds of medications and stay at home and lose life. It's just incredible. So anyway, we need to deploy around 10% of GDP on the health, which is very, very important. You're spending 1.25% less than Bangladesh and Sri Lanka, which is very shameful. Next election should not be fought on Mandir and Masjid, but on health or no health. You need to give the government performer Paresh mantra. I think, we got a new team now in the government, and, like corporate sector, they need to have a 3-month goal. Give a 3-month goal, achieve this in the next 3 months, then audit, and those who don't perform should be removed. And that's the way, corporates work, and that's the way, our government should work as well. Otherwise, there'll be more deaths in India. So we need to ramp up the healthcare infrastructure, particularly ICU and STU, and our unit is taking steps in this direction, particularly pediatric ICUs and oxygen beds and CCCs. And the mutants will come like, variation of concern and vaccine escape variants. We know that 50 to 70%, vaccine dodging can happen by these new variants like the Epsilon or the Delta Plus. So you need to, or the Lambda. And so mask is the only way by which you can get 100% protection. It's called as a social vaccination, as I mentioned. So available vaccine, what is best? Covaxin seems to be the best because it is a whole virus vaccine. And second, it is 2 doses within 4 weeks. So you are immunized within a month or two. Next is Oxford, AstraZeneca, then Sputnik being used. Zydus is coming with injection-free vaccine, should be quite useful for kids. So last but not the least, you need to respect the healthcare worker. There's a saying in our mother tongue, Sankata Pandaga Venkataramana. That means we go to God and doctor during our difficulties. I think these healthcare workers are your real heroes, not netas, babus, judges, film or sports personalities. So I'd like to sort of conclude with this, both in Kannada and English. Let's start with Kannada. ನೀವು ಅನಾರೋಗ್ಯಗೊಂಡಾಗ ಆಸ್ಪತ್ರೆಯಲ್ಲಿ ಬೆಡ್ ICU ವಾರ್ಡ್ ಆಕ್ಸಿಜನ್ ವೆಂಟಿಲೇಟರ್ ಸಿಕ್ಕಿಲ್ಲವೆಂದು ವೈದ್ಯರೊಂದಿಗೆ ಗಲಾಟೆ ಹೋರಾಟ ಮಾಡಬೇಡಿ. ಯಾಕಂದ್ರೆ ನೀವು ಆರೋಗ್ಯವಾಗಿದ್ದಾಗ ಹೋರಾಟ ಮಾಡಿದ್ದು ಮಸೀದಿ, ಮಂದಿರ, ಚರ್ಚ್, ಜಾತಿ ಮೀಸಲಾತಿ ಮುಂತಾದವುಗಳಿಗೆ ಮಾತ್ರ, ಆಸ್ಪತ್ರೆ, ಶಾಲೆ, ಕಾಲೇಜುಗಳಿಗೆ ಇಲ್ಲ. ಸೊ ಯು ಫಾಟ್ ಫಾರ್ ಮಂದಿರ್, ಮಸ್ಜಿದ್, but not for hospitals and schools and colleges or education. So this is the one message. And second is that we fought for temples, we fought for masjids, we fought for statues, but we didn't fight for hospitals. Everything is closed but hospitals. We fought for pandits, we fought for always, we fought for godmen. We never fought for doctors. None are rescuing us but doctors. We fought for culture, we fought for traditions, we fought for caste, we fought for religion, but never fought for science. And science seems to be the only savior. And last but not least, we fought for leaders, we fought for parties, we fought for ideologies, but we never fought for health and education. So let's join healthcare workers in their war for dignity. And this is very, very important. I think the health and education is the most important and most neglected by the country. And doing spin doctoring called as Jumla is not going to help. So I think this government has done a good job and really great job in the first wave. So we want a repeat performance of the first wave performance for the third wave, not the second wave performance where everybody failed. So, I wish you all the best for the rocky next few months. And I thank you very much for the patient listening. I'm an orthoplasty surgeon, there's a joint replacement surgeon, and there's a very basic dictum, rules in the joint replacement surgery. If you fail to prepare for surgery, you prepare to fail. Such is the reality now. If you don't prepare for the third wave, you're definitely going to fail. And septic revision is my passion. I give talks across the world, talking about these infected revisions. And the key message, as a septic revision surgeon is to fight infection is you need to be radical. You can't be soft, nappy-bampy and say, I don't want to upset netas, I don't want to upset babus. And, then the virus is going to kill you. So you need to be like a surgeon, use the blade ruthlessly against the virus like a cancer. Then you can save life and livelihood. So I thank you very much for the present listening, and I welcome any questions. And just remind me again, I will just give a demonstration of how to use the mask properly. Thank you.